I'm asked all the time, what is the addiction potential for psychedelics? And this is important because there was so much propaganda about how this is your brain on drugs. And psychedelics were lumped in the same category as heroin and cocaine, which is very unfortunate because as you can see on this chart developed by Dr. David Nutt, psychedelics are a lot less addictive than other medicines. If you look at the chart, alcohol is that huge column that's on the left. Alcohol is the most addictive and destructive drug. And isn't it interesting that that is the legal drug in our culture? And way over on the right, in the smallest category, are mushrooms. And that color coding, that pink, shows how it impacts life is more while the drug is acute than when it's not present. So that's non-addictive. And then you see things like LSD, ketamine, MDMA, all of those are over on the right side of this chart. And then things like tobacco and alcohol and cocaine and heroin are over on the left side of the chart, much more highly addictive. It's important to note on this chart that ketamine isn't all the way over on the right with psilocybin, LSD, and MDMA. Ketamine does have some addiction potential, but it's much, much less than even cannabis or tobacco. In fact, psychedelics are now being studied as a substance use disorder treatment. Johnson and Garcia-Rameau's study indicated that the naturalistic psychedelic use may significantly impact problematic alcohol consumption. In this study, 83% of participants no longer met the criteria for alcohol use disorder after a moderate or high dose of psychedelics such as LSD, 38%, or psilocybin, 36%. While this finding doesn't necessarily establish that psychedelic can treat alcohol use disorder, it definitely implies that it reduces addiction potential. In fact, recent research is showing that psychedelics do help with substance use disorder treatment. Psilocybin can treat alcohol and tobacco use. Clinical trials at Johns Hopkins in 22 and 23 showed that psilocybin-assisted psychotherapy significantly reduced alcohol and tobacco use, and participants reported lasting abstinence, often linked to mystical experiences and increased motivation. It's interesting to note that there's a questionnaire called the MEQ, Mystical Experience Questionnaire, that correlates with all kinds of good outcomes with psychedelic medicine. In fact, the higher the scores on the MEQ for mystical experience, it correlates to reduction of substance uses and also enduring, lasting positive change. So what's the mechanism? Psilocybin acts on the 5-HT2A receptor system, and this enhances neuroplasticity and disrupts the default mode network, the DMN, and this potentially breaks addictive patterns. There's a recently more known psychedelic called Ibogaine. Ibogaine is incredible for opiate use disorder treatment. Observational studies note the reduced opioid withdrawal and cravings, but there is some cardiac risk with Ibogaine, like arrhythmia, so it limits its clinical use. But research needs to focus on safer analogs or adjunct therapies to mitigate these risks because Ibogaine is so powerful in helping people with opioid use disorder. Ayahuasca has been known for centuries in South America to be powerful for treating substance use disorders. Observational data shows in South America that research studies associate ayahuasca use with reduced cocaine and alcohol dependence, and this is attributed to introspection and experiences with emotional processing. MDMA, PTSD comorbidity with substance use disorder is very high. And so when we treat PTSD with MDMA, it also subsequently reduces alcohol and substance use disorder. We don't know the mechanisms of action exactly with how psychedelics work, but we think it's linked to neuroplasticity. Psychedelics promote synaptic flexibility, and it adds to the restructuring of maladaptive neural pathways. We also look at psychedelics and how they modulate the DMN, the default mode network. That reduced DMN activity correlates with ego dissolution, potentially altering self-narratives tied to addiction. Psychedelics have anti-inflammatory effects. Now, emerging evidence is linking psychedelics with anti-inflammatory properties to reduce neuroinflammation in addiction. Recent developments in phase 2 trials from 2023 show positive outcomes for psilocybin in alcohol use disorder. FDA designations, MDMA-assisted psychotherapy for PTSD received breakthrough therapy status, potentially influencing addiction research frameworks. Psychedelics have a transformative potential in addiction treatment, particularly when combined with psychotherapy. However, large, rigorous studies and safer protocols are needed to establish efficacy and scalability. Ongoing research needs to focus on understanding and optimizing the therapeutic models combined with psychedelic therapy to address safety concern and really potentiate our ability to treat substance use disorder and alcohol use disorder. So in Module 1, we covered psychedelics and the cultural landscape. We explored the psychedelic renaissance. We explored MDMA, psilocybin, and ketamine, which are the most researched psychedelic medicines. We looked at research, past, present, and future. And finally, we explored the addiction potential of psychedelics and how actually psychedelics are now being used for treatment in substance and alcohol use disorders. I look forward to meeting you for Module 2, which is the P of the Panther method, preparation. We'll look at how psychedelics are a novel treatment, explore legality, ethics, and licensing. We'll look at that acronym Panther and the preparation. Who's appropriate for psychedelic therapy? We'll explore how to gather history on your client, build rapport, and create safety. We'll talk about how to avoid the guru syndrome. And we'll talk about steps to proper preparation for the medicine session. I look forward to seeing you there.